Hi, I'm Gary Fournette, and I'm here with Chris Costa today. We put together a stretching video to help complement the exercise video you may have already watched. This is going to be vitally important, especially for our patients who have just completed therapy, either chemotherapy or who are currently on therapy. For example, our breast cancer patients who are on anti-estrogen therapies. Those are very well known to cause achiness, sometimes even some fatigue, and stretching can really help ameliorate some of those problems. So Chris, I was wondering if you could tell us some of the benefits of stretching in general.
Sure. The stretching increases your range of motion. It also decreases stress, overall body image improvement, and just an overall improvement in your quality of life.
And of course, we've emphasized several times through both videos the importance of getting a doctor's permission. Assuming that permission, how often should a patient exercise?
We would prefer that people stretch every day because it really does, it's a cumulative thing, and it is important to stretch every day. But you will see benefits if you stretch about 2 to 3 times a week.
And of course, many of our patients are deconditioned to begin with, and we wanted to show a wide range of exercise, but I think it will also be true that we don't expect every patient to be able to do every exercise, either at the beginning or maybe even ultimately.
Right. I wanted to show everybody in the video all stretches that would help all different parts of the body, but it is important to note that you don't have to do every stretch to the level that I am doing it in the video. You can take it very slowly, and in the beginning you might start really slowly and just do it for a few breaths. And then we recommend, though, that you try to stay in it a little longer. Your body's going to let you know when it needs to stop. So just go into the stretch slowly, hold it, breathe through it, and then maybe just do 2 to 3 breaths or 2 to 4 breaths the first time. And then eventually over time you will find that it will let go and relax, and maybe the next time you try for 4 to 6 breaths and go from there.
So rather than stretch for one period for a very long time, just like an exercise, better to do a little bit each day and work up gradually to your goal.
Yes, we do find, and a lot of people don't realize this until they start stretching, is that you can actually get pretty sore from stretching if you haven't stretched before. So we do recommend that you take it slowly.
Sure. And we've also put in a section on abdominal stretches and exercises. Could you talk a little bit more about those? Sure.
The abdominal area that we're focusing on in the video is what we consider the core muscle groups, which is the lower belly, the lower back, and the inner thigh. So we've done a couple of exercises in the video that gears towards those muscles. We do recommend that you try to do those in the beginning slowly as well. We don't want anybody to rush into that as well, but we do say that you can do it 2 to 3 times a week to see benefits, but you can do abdominals every day. And we do say to maybe start with a set of 10 to 20 in the beginning if you're really deconditioned, but we do stress that over time you do want to increase the amount that you're doing so that you see overall improvement.
Like the regular stretching exercises, we do recommend that the abdominals be done with the doctor's permission also.
We do recommend that you always have a doctor's permission whenever you start any workout program, even stretching.
And the stretching exercises don't necessarily have to be distinct from your exercise, is that correct?
No, we do say that when you're doing your exercise program, it is a good idea to stop for a second and maybe do a few stretches after you are warmed up, because you will find that the exercise and the stretching complement each other so well, so that when you're warmed up from the exercise, the stretching will usually let your muscles go a little bit faster.
Well, we're excited about some of the benefits that I think you're going to notice, especially with the combination of the stretching and the exercise videos we put together. I think you'll notice an improvement in your core strength, in your balance, in your endurance, and your sense of well-being, and even mood. So we look forward to sharing these videos with you today.
Breathing. While stretching, it is important to breathe deeply. Breathe in through the nose and out through the nose. Before you start your stretching routine, take 3 to 4 deep breaths. Each stretch should be held for a minimum of 4 to 6 deep breaths. Hold the stretches for tight areas of the body for 10 to 20 breaths. The longer you can hold the stretch, the more the muscles will release. The three basic stretching equipment that was used in the video is the yoga strap, the foam roller, and the Pilates ring. I recommend the Pilates ring for most stretches in the video because it's easy to use. Lower body stretches. You can use a strap or a Pilates ring for these stretches. Start with both legs in the ring or the strap. Pull straight legs towards you. Straighten the knees with your hands if you need to. Put the left leg in the ring, pulling it towards you. If this is too intense, you can bend the knee of the leg that is on the mat. Let the left leg fall out to the left to stretch your inner thigh. You want to bring your left leg back up and pull in slightly towards you, then cross the midline of the body to stretch the side of your upper leg, known as the IT band. Bring the leg back to the center. Put your right foot on the left knee. The left leg is straight and pull it in towards you. Then bend left leg to stretch the right hip. You want to go back into the center, put the right leg in and take the left leg out and repeat all stretches on that leg. IT band stretch with the foam roller. Take your foam roller and put it under the side of the leg that you are stretching. The other leg is bent behind you for support. Roll up and down on the roller on the side of the leg, known as the IT band. When you feel tender or tight spots on the IT band, hold there to see if they will release. Roll up and down about 10 to 20 times. Then switch to the other leg. It is a good idea to do this stretch daily if you have knee or hip problems. The back stretch, also known as cat and cow. Go down to the mat on your hands and knees. Knees are about hip distance apart. Inhale and round your back to stretch your upper back and shoulders. Exhale and arch your lower back while you look up. Back and shoulder stretch, also known as the child's pose. Start on your hands and knees on the mat. Bring your butt down towards your feet with arms reaching out in front of you. Shoulder and side stretch. Start on your hands and knees. Leaving your butt up, reach out your arms for a shoulder stretch. Walk your hands over to the right and lean into the left arm to feel the stretch down your left side. Walk your hands over to the left and lean into the right arm to feel the stretch down the right side. Then return back to center. Shoulder stretch. Start by lying on your stomach. Take your right arm up on mat. Take your left arm and thread it under your right arm. Then take right arm across and under your chin. Make sure both arms are as straight as possible. To enhance the stretch, push off your feet so that your chin comes up over the arms a bit. Then switch sides by taking left arm straight and threading the right arm under the left arm. Note, most people don't stretch their shoulders a lot, so this might seem difficult at first. The more you do this stretch, you will find it becomes easier and your shoulders and neck will feel much more flexible. Hip glute stretch, also known as the pigeon pose. Start on your hands and knees. Bring your left leg in and under the body to stretch the left hip area. For a more intense stretch, move your leg towards the front a bit more. To feel it in different parts of your hip, after in the position, shift your weight to one side or another to find more tightness and hold it there. Then take the left leg out and switch to the right. Repeat the above steps. Spine stretch. Lying on your stomach, take your hands overhead and clasp your fingers together. Push your hands away from you as if someone is pulling your hands and feet. This will stretch out your whole spine. Shoulder and lower back stretch. Lying on your stomach, take your arms overhead. Bring your arms back, pinching your shoulder blades together, similar to a swimming movement. Repeat 10 to 20 reps, adding more on as your strength and flexibility improves. Then add in a torso lift to stretch out your lower back as well. Repeat 10 to 20 reps depending on your strength. Neck and chest stretch, kneeling. On your knees, take hands behind their back and clasp together. If you have trouble being on your knees, you can do sitting. The ring or the strap can be used to help if you have trouble getting hands behind the back. This will accentuate the stretch. With hands behind you, take the right ear to the right shoulder, then switch to the left. Shoulder blade stretch. Kneeling, take your head to the mat as if you're in child's pose. Take your hands behind you and clasp together. Use the ring or the strap if needed. Try and bring clasped hands overhead as much as possible to stretch out the shoulder blade area. Lower back stretch. Lying on your stomach, put your hands about shoulder width apart. Push off the floor and extend arms as straight as possible to get a stretch in the lower back. If your back is extremely tight, try going to the elbows first, eventually working up to fully extended arms. Shoulder and lower back stretch. Lying on your stomach, take hands behind you and clasp together. You can use the ring if needed. Lift your torso while hands are clasped. Inhaling on the way up, exhaling on the way down, in and out of your nose. Do 10 to 20 reps of this stretch. Inner thigh stretch, also known as the frog. Start on hands and knees. You want to lean back and take your knees wide. Try and bring your chest to the floor. To make the stretch more challenging, take the knees wider and turn your feet out. Hip stretch. Start in a seated position. Take your right foot and stack it on the left knee. Lean forward to feel the stretch in the right hip. Then take your left foot and stack it on the right knee to feel the stretch in the left hip. Inner thigh stretch. Start in a seated position. Bring the bottoms of your feet together. Turn the feet up a bit to get more of a stretch. Lean down towards your feet slowly. Your goal is to get as close to your feet as possible. A good idea with this stretch is to inhale and exhale, and on the exhale, try to push yourself closer to your feet. Some people may feel this more in the hips than in the inner thigh. Neck stretch. In a seated position, take the right ear towards the right shoulder. Bring the right hand up and gently pull the neck over towards the shoulder. Then switch sides. Take clasped hands behind head and gently pull the head down with your chin moving towards your chest. Lower back twist. Sitting Indian style, take one hand to the opposite knee and twist looking behind you. Then switch sides. Side and shoulder stretch, seated. While seated, take the ring or strap or clasp your hands overhead. Take over to one side to stretch the side of the body. Switch to the other side. Push your arms back behind your body to stretch your shoulders and underarm area. Shoulder stretch seated. Take one arm in front of you across the body. You need to have the arm as straight as possible. Use the other arm to gently pull that arm across the body, feeling the stretch in that shoulder. Then switch arms. Shoulder blade stretch, seated. While seated, take your arms overhead. Bring both arms down, pinching your shoulder blades together. Hold for 1 to 2 seconds. Then move the arms back overhead. Do 10 to 20 reps. Hamstring stretch. Sitting on the mat, take your legs out in front of you. Lean forward and reach for your toes. Try not to let your knees bend or feet turn out when doing this stretch. If there's a lot of tension in the back of your hamstrings, just go down to whatever part of your leg you can. There's no reason to force it down to the feet. Lower back twist. Lying on your back, bend your left knee. Twist your left knee over the right leg to twist the body to the right. Arms are out and palms are up to stretch the chest also. Then switch sides. Back twist. Using the strap or ring, put one leg into it and bring the leg straight in towards you. Then twist over the other side of the body. Both legs need to be as straight as possible. Then switch legs. Lower back stretches. Lying on your back, take your knees in towards your chest to stretch your lower back. Then bring your feet up in the air, grabbing your feet with your hands. These two stretches are really good when you're having any lower back pain. Hip stretch. Start on your hands and knees. Take your left foot forward. Then go down to the elbows. If this is too hard, start by staying on your hands. Let the left knee fall out to the left a little to accentuate the stretch. Then switch to the right leg, letting the right knee fall out to the right. Shoulder blade and hamstring stretch standing. Stand with feet hip distance apart. Take the ring or the strap behind you. Bend over at the waist. Try to keep your knees as straight as possible. If this is too much of a strain on your hamstrings, bend your knees slightly. Let your shoulders fall forward for a shoulder stretch. Ab exercise, V-sit. Start by sitting. Bring your feet off the ground and arms out at your sides. This exercise works the core muscles. Start by holding 10 to 20 seconds and work up from there. Ab exercise, the plank. Start on your elbows and knees. Put your weight into your forearms. Walk your feet out into a plank position. Make sure your butt is not too high up in the air. Hold in this position for 10 to 20 seconds to start and work up from there. Ab exercise, reverse crunch. Start by lying down on your back. Put your hands under your butt for support. Bring your legs up to a 90-degree position. Bring your legs towards you and back to 90 degrees. Start with as many reps as you can do before you fatigue the abdominal muscles. Try to work up to 100 reps, taking breaks as needed. During your breaks, twist your back to stretch out your lower back. Your goal is to eventually do 100 in a row with no breaks. Ab exercise, reverse crunch with ball. Lying on your back, take a stability ball and hold in your hands. Bring your legs up to a 90-degree position. Bringing legs in towards the ball, wrap your feet around the ball, then back to 90 degrees. To advance with this exercise, move the ball further away from your feet. Do a set of 20 to start, and then work up from there. Ab exercise, abdominals on the ball. Sit on the ball. Roll down over the ball a bit so that you can use your abdominal muscles to crunch up. Cross arms on chest, doing a crunch up. Go slowly and do as many as you can until your ab muscles fatigue. Variation to this exercise is to bring arms out and back as you crunch. To work the size of the abs, take the arms out straight and crunch towards one knee, then the other. All of the abdominal exercises should be done until you feel fatigued in the ab muscles. Lower back stretch on the ball. Lie on your stomach on the ball. Lock legs wide behind you to aid in stability. Lift up torso with arms lifting up as you go. You can also keep arms at your sides if you have any shoulder issues. Rest by draping over the ball to stretch the spine. Then come off the ball on your knees and stretch out your shoulders by rolling ball out into child's pose. Spine and hamstring stretch on the ball. Start by sitting on the ball. Roll back carefully until your body is draped over the ball as far back as you can. A couple of safety tips. Don't close your eyes when you are doing this stretch. Also, have someone spot you the first few times you try this stretch. Then sit up and lean forward with legs straight and toes up to stretch your hamstrings.